Good afternoon to everyone. Today I deliver the topic is cerebrovascular accident. Myself Ms.k.varalakshmi, nursing tutor, E.S College of Nursing, Vis. Introduction. Brain is the largest and most complex part of the nervous system. It is composed of more than 100 billion neurons and associated fibers. Circle of Willis is responsible for blood supply to brain. Rupture of any of the artery or occlusion may lead to CVA. Then move on to the definition. Cerebrovascular accident is the sudden death of brain cells due to lack of oxygen caused by blockage of blood flow or rupture of an artery to the brain. Then move on to the incidence. Stroke is a frequent cause of death. It is the third biggest killer in India after heart attack and cancers. A stroke happens every 40 seconds and every 4 minutes someone dies for stroke. The incidence of stroke increases with age. Mainly people between 40 to 60 years are affected. Brain infarct or stroke occurs 30% more frequently in men than in women. It is projected that by 2020, the number of cases of stroke would increase to 1.6 million in the country. Non-modifiable factors: age, gender, family history. Modifiable factors for hypertension, heart disease, smoking, excessive alcohol consumption, obesity, sleep apnea, metabolic syndrome, lack of physical exercise, and poor diet. Drug abuse. Types: there are two types. One is cerebral thrombosis, another one is cerebral embolism. Cerebral thrombosis, atheromatous plaque of hard fatty degenerative material may form in the artery of brain, resulting in clot formation. Cerebral embolism, a clot may have formed in vessel outside the brain, such as one of big vessels in neck of thorax or heart itself. Then types: ischemic stroke. It accounts for 83% of all types of stroke. It is two types. One is embolic, another one is thrombotic. Then pathophysiology. Due to etiological factor, increased intracranial pressure in the brain that leads to high blood pressure in cerebral vessels, that leads to cerebral vessels or breakdown because of the increased blood pressure, that leads to cerebral hemorrhage. Bleeding will be occurred due to thrombus and emboli. Then leads to cerebrovascular accident. Clinical manifestation. There are many types. One is muscular, difficulty walking, paralysis with weak muscles, problems with coordination, stiff muscle, paralysis of one side of the body. Visual, blurred vision, double vision, and then visual loss. Whole body, fatigue, lightheadedness or vertigo. Speech, difficulty in speaking and then slurred speech. Sensory, reduced sensation of touch, facial, muscle weakness or numbness. Also common: balance disorder, difficulty swallowing, headache, inability to understand, confusion, rapid voluntary eye movement. Diagnosis: history collection, physical examination, CT, head plane, rarely MRI, cerebral angiography. Lumbar puncture optional and during recovery phase to look for chronic meningitis. Other routine investigation is blood investigation, triglyceride level, urine examination. Medical management: aspirin is an immediate treatment given in the emergency room to reduce the likelihood of having another stroke. Aspirin prevents blood clots from forming. Tablet aspirin 325 mg per OD is given orally, intravenous injection. Tissue plasminogen activator. An injection of TPA is usually given through a vein in the arm. This potent clot busting drug needs to be given within 4.5 hours after stroke symptoms begin. If it's given in the vein. Recommended dose of TPA for acute ischemic stroke: 0.9 mg per kg, maximum 90 mg, infused over 60 minutes with 10% of the total dose administered as an initial intravenous bolus over 1 minute. In cerebral venous thrombosis, low dose heparin as 5000 international units subcutaneously is given 8 hourly for 7 days. These are all the medical management for CVA. Then surgical management. For ischemic stroke, carotid endarterectomy, surgical procedure to open or clean blockage in carotid artery, bypass graft. Thrombectomy, for patients with an identified thrombus in order to restore circulation. That's why thrombectomy. Surgical management. In case of aneurysm, surgical clipping. Clip is placed in a neck of aneurysm to stop bleeding. Rehabilitation. Rehabilitation begins once the patient is stabilized. Encourage the patient to do as much of his or her work as possible within increased independence. ADL includes bathing, dressing, toileting, gait training, and so forth. Teach patients transfer techniques. Encourage family participation. Complication: deep vein thrombosis, pulmonary embolism, aspiration pneumonia, spasticity, joint contractures with associated pain, post-stroke depression, recurrent stroke, bed sore, hospital acquired sepsis. These are all the complications of CVA.